ready?
Okay, so in this cupboard, there's more stock in one of the other rooms, but we keep them in this cupboard just to make it easy for when you are drawing. There's overflow of some of the needles and stuff. You're not going to be using any of those, but Dee likes to keep those in there.
I like those.
This is the packet that has all four of the vials. So you'll always just draw all four of the vials. That way you know that you haven't missed anything. And then even if some of them don't get used, it's fine. The lab order form is where all of those get chosen for what you want. For instance, like a thyroid, a TSH, a T3, a T4. You can check that all up there, but just to make it easy for yourself, always just draw all four of those. Okay, so that you would pull out, put that there. These are the butterfly needles. It's a 21 gauge. You always want to use a 21 gauge. We have one other size that's a smaller 23, 24 maybe. It's a pediatric. Don't use that for an adult blood draw because it's a pediatric. Okay, so these sometimes come together, sometimes they come separately. Right now, we currently have them separated. We should and could just purchase ones that come all in one, but this is your vacutainer hub. Normally, if they come together, they're pre-hooked up to this already, but you, for right now, are going to unscrew that one and take that off and screw that one in, like so. When you draw the labs, you're gonna put the actual plug in there. It's vacutainered, you're gonna push it all the way in, it'll puncture. It'll fill it up until you're finished, and then once it finishes, you take it out and you do the next one. That's that. There's all of your labs. Okay, so over here are your tourniquets. There's more tourniquets in here if you need more of those. But just put them back here and reuse them. There's no need to throw them away every single time unless it gets contaminated or soiled or something. You can use one of those if you want to put that on after. There's some cotton. I honestly just use cotton and tape, but whatever a person prefers. There's some alcohol wipes. Right, there's that. Gloves. Okay. So everything that you should need. So you'll place the tourniquet on the person. You'll find the vein. Someone's actually coming in. You'll wipe with alcohol. You'll insert the needle. You'll draw all four of your vials. When you're finished, you'll take the tourniquet off first. We'll go over that. You'll pull the needle out. You'll place this on at the same time. Rewrap it. Patient's done.
Awesome.
And pause that.
So that's the blood draw, and now you're going to go over what to do with the blood to prepare it for the lab.
Yep.